Hello. Good afternoon. Up just a little bit after 12. This is your internist, Dr. Berry, board certified internist, founder at drpierceblog.com, author and speaker. Bring you another edition. I think we're on episode 8 of the Lunch and Learn with yours truly. We are starting a little bit early today. I actually have a couple of doctor's appointments that I have to go take care of. So I am starting a little bit early and we'll be finishing up a little bit quicker today. But I definitely wanted to talk about, Maria, definitely wanted to talk about the infamous flu vaccine and something that I run into a lot, probably like 3 to 5 times every week, as far as the statement of I don't believe in flu vaccine. That's the reason why I'm not going to get it. So quick housekeeping, a couple seconds, going to quickly share this on my page, and then we're going to, hey, Dr. Lenise, then we're going to get this thing started. All right. All right. Hey, hello. Sorry, let's get this started. So first I'm gonna start off on my soapbox on why I felt that I definitely had to talk about this. I had 2 patients just yesterday give me the same reason why they didn't want their flu shot is because they didn't believe in it. My connection is weak. Let's see if we can fix. Let's see if we can fix our connection. Hey, Dr. Tamika. Now, saying my connection is weak, so I'm not sure if I'm frozen or not. But, we're going to keep on going until this thing kind of tightens up on their own. Eddie, what's going on, bro? Okay, so again, I wanted to kind of start out. Dr. Berry, board certified internist, founder at drpsblog.com, author and speaker. Today, Lunch and Learn is going to be focused on the flu vaccine and why we got to start believing again in the flu vaccine. Oh, thank you, everybody. Let me know I'm not frozen anymore. 2 patients, and again, I get this probably like 5 times a week when I say, hey, do you want your flu shot? No, doc, I don't believe in the flu shot. I'm not sure what it is to not believe in the flu shot, but I get that so often, so I definitely wanted to kind of put it out there, put some numbers out there so you guys can get an idea of why us physicians, especially the primary care physicians in the pharmacies, you go to Walmart, CVS, Target, everyone's trying to give you the flu shot, why we're so big on it. In my practice alone, I think I have a majority, pretty much, I guess, a middle-aged practice. I don't have a prototypical internal medicine where we have a lot of like 67-year-olds in my practice. So I deal with a lot of young patients, which makes it even more difficult to kind of get them to get on my flu vaccine train. So let's first of all, let's talk about the flu. The flu is a virus, of course, and it's something that you can get symptoms including fever, runny nose, body aches, pain, some shortness of breath, some cough. You can get a slew of symptoms that are kind of vague, but really kind of hone in. Especially if you have like body pain and aches, that kind of hones us into thinking like, oh, I think you may be dealing with the flu. But when you do get these flu symptoms, when you do get the flu issues, sometimes you can be contagious up to a day or so before you even start getting the symptoms. And even once the symptoms really kind of hit, you can up to like a week afterwards, you can be contagious where you can give that flu to someone else. And for my younger patients, what I get a lot is my body's going to fight it. I'm just kind of get over it. And which is true. Your body, especially my younger patients, you can kind of fight through a lot of discomfort and pain. But a lot of times when you talk about, especially me, when I'm talking about giving you the flu vaccine, I'm not necessarily, especially my younger patients, I'm not necessarily worried about you not being able to get over it. I'm more worried about your aunt, your uncle, your grandma, your grandpa, you know, the ones who have some issues where even niece, nephew, son, daughter, ones who can't fight the flu infection as well as you can. So sometimes I feel, you know, when we talk about giving you the flu vaccine and all of the prevention from it, when my younger patients, is much more difficult because they feel like, oh doc, I'm just kind of get over it, and that'll be that. And sometimes we have to think, and again, I'm putting my, you know, my public health hat on. We kind of have to think about all of those around us moving forward. I'm gonna give you some numbers just to kind of give you an idea of how serious the flu vaccine is just in the United States. In the United States, about $10 billion per year is lost or is pretty much charged from a healthcare standpoint due to the flu vaccine. About almost $18 billion a year due to lost wages, you know, having to take time off because you got sick and everything else in that regard. So a lot of money is affected with this, you know, this flu vaccine that for some reason a lot of people don't believe in. It results in about 32, let me see, I think the number was, let me look here. Yes, 32 million outpatient, you know, doctor visits are due to the flu. About 200 to 300 hospitalizations in the United States again are due to the flu. So again, when we talk about, you know, the flu and you know, the seriousness of it, it's definitely not something that you know, we take for granted. I think one of the biggest things is that, again, for my patients who are, especially I'm talking to my younger patients, because those are the ones who always give me that they don't believe in the flu vaccine. But my older people do though. My older patients, my 40, 50, 60-year-olds, they tell me too that they don't believe in the flu vaccine. And again, it's bad because, again, a lot of times you're kind of just thinking about self. And you're not really thinking about all the others that kind of get affected when you don't get your annual flu vaccine. And all of the studies have shown you can drink gallons of orange juice. It don't matter. The number one way to treat and prevent the flu is just getting your regular flu shot. So now let's talk about the flu shot, because again, this is another one I always get. Doc, when I got my flu shot, and 2 days later I got the flu. So my patients out there so let's do a quick little education. The flu vaccine that you get, you know, in your doctor's office, in Publix, CVS, all these other places here, it's a dead virus. Dead virus. So unless your name is Jesus, you are not bringing the flu vaccine back to life. So the likelihood of you getting the flu because of the flu vaccine is pretty much zero. It's like not happening, right? But when we think about it, like, when do we give you the flu vaccine? We usually give it to you during cold and flu season already. So you already had a higher chance of getting the flu vaccine anyways. So it's not even a matter of I just happened to give you an injection and all of a sudden your body's so weak and now you got the flu shot. No, you was already likely going to get it anyways. Why? Because you probably hang with people who don't get the flu vaccine, period. And a very common misconception, ages 18 to 64 is the most common group affected by the flu shot. So again, this isn't a young person's disease. This isn't an old person's disease. It's y'all 18 to 60-year-olds who are getting these flu shots. But the problem is y'all give it to my elderly patients. Y'all give it to y'all nieces, daughters, and sons, and then that's when the problems arise. There's some other, I talked about the age, but if you have lung issues like asthma, COPD, you're likely to pick up the flu in general, and you definitely should be getting the flu shot. If you have issues like diabetes, it's another risk factor for patients who will need to get the flu shot as well. So thyroid disease as well is like some of my biggest ones where you need to get the flu shot. So again, don't think because you're in this age where you're like invincible and you don't think you need to get the flu shot, that it's that you're immune from it, because you're not. In that regards, you just happen to be lucky enough not to end up in a hospital from it. But again, like I said, if you're my asthma patient, If you're my COPD patient, you're my diabetic patient, you're my patient with some type of liver disease as well. Again, these are all people who should be getting the routine flu shots. And the problem is those folks are actually getting it. So it's not like my COPD and my asthma folks aren't getting the flu shot. They're getting it. The problem is my young invincible folks, or my folks who believe that the flu vaccine is some believe being that, you know, doesn't really work. You guys are the one that's kind of passing it around. So the next time, you know, when you hear about the flu shot, the next time when you think about a flu shot, just remember, like, you're getting a flu shot not really to protect, yes, to protect yourself. That's a big thing, but really you got to protect everyone else around you, because that's the most important thing. Because again, I'm 34 years old, and I have to get the flu shot just because I'm around so many sick people, whether in the hospital, nursing home, or in my office. So we get the flu shot from a protective standpoint. Most of your hospital workers have to get the flu shot, again, from a protective standpoint. But it's worse because, and it's funny too, especially from a hospital setting. Like my nurses, I know I got a few nurses on the video today. Your job requires us, right, to get the flu shot, but you know, patients don't have to get the flu shot. Patients' family don't have to get the flu shot. So then they end up bringing that sickness to us, which happens a lot. But you know, this is kind of what we signed up for when we got into healthcare. So we just kind of deal with it in that regards. So again, just to kind of recap, we are talking about the flu shot. We are talking about the importance of the flu shot. We talked about the signs and symptoms of it, including, you know, fever, chills, body pain, runny nose, all these things that kind of sound like your regular upper respiratory infection. But, you know, a lot of times, depending on the severity of it, how long it's hit you, kind of leads us physicians to more thinking, yeah, you probably got the flu more than anything else. We talked about people who need to get treated with the flu vaccine. Everybody, and we talked about the reasons why, but especially, like, again, if I had to list, my young people need to get their flu. In fact, I'm taking my son and daughter to get their flu shot. No, I think flu shot or pneumonia shot, one of those shots today. Talked about my elderly patients, definitely need to get your flu shot. No reason why you shouldn't be getting a flu shot. We talked about my diabetics, my patients with liver disease, kidney disease. All of these patients fit the bill of needing to get the flu shot. And then the most important aspect of it is that this flu is costing us as in taxpayers, us as in the United States, a lot of money. Again, $10 billion a year just on healthcare costs related to the flu shot. About $18 billion a year just on job productivity loss. Like, you can't go to work because you got the flu, you out for like 2-3 days. So a lot of money's being lost because of not getting that flu shot. And again, we just have to kind of think about others, and we've kind of like dispelled that myth that the flu vaccine gave you the flu. It cannot give you the flu unless your name is Jesus and you can bring back that thing as a life. And likely we're not vaccinating Jesus. So you're not Jesus. You're not going to bring the flu vaccine back to life. It did not give you the flu. You was already going to get it anyways. So before I head out, again, I want everyone to go ahead and check out. Again, I did release my free ebook, drpierresblog.com/books. Go ahead and download that today. Great read. Like I said, if you've been following the blog, you kind of understand and aware of what we talked about as far as the affirmation 2016. You guys have a great and blessed day. I'm about to head out of here for our run late to this next appointment. Y'all have a good one.